Hi guys, it's Lotta behind the lens, and it is more Lotta uncut, and it's gonna be uncut until we figure out how to edit. This is our new addition to our family. Her name is Ronni, and she came to us yesterday. Actually, Marie bought it for me, so when she's not here, I can snuggle with it. Speaking of Marie, we have a special guest.
Hello. I'm supposed to be the behind the scenes person with all the great video talent, as is the last video you see. Somebody needs to hire me. I'm for it. Anybody who knows me knows that technology is not my friend at all, and I don't care to be its friend.
But the channel is called Marlotta.
Yes, and she makes me make an appearance. Yes.
Every once in a while.
My arm is twisted up around my back as we speak.
Well, she's been missing, guys, so she does exist. She's not like Ronni, a unicorn fairy that I made up in my mind.
Mm-hmm.
She does exist.
A lot of characters in there.
She has a couple of two.
Yeah. Well, I don't know what to talk about. She said I need to make a video, so...
How you been?
Same old shit, different day.
They don't know that. What shit you
Work?
been doing? Hey, this is YouTube. I don't know if you can say shit.
You done said it now. We don't edit. It's supposed to be uncut because we don't know how to do shit. So, beep, 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 I guess. I don't know. Work. That's all I do is work.
And go to the hospital.
Work. If I'm not working, I'm just trying to sleep. If I'm not trying to sleep, I'm at the hospital with Lotta. If we're not at the hospital, then we're at a doctor's office somewhere. That is my life. That is my life.
Pretty interesting.
Man. Epic.
Yeah. She's
I don't know why we don't have like 2 million viewers.
Right? We should have a lot of
just
supporters.
so interesting.
Cute. That's because we're not uploading, but we're working on it. As you can see, we trying to come with some content, and we need you guys.
Content.
We need you guys to give us some ideas. I told you we struggling right now because I'm a little sick. You see, I got my TPN set up in the back for 3:45. Is it 3:45? Yeah.
Yeah, if not 4 something by now.
Yeah, for 3:45 set up. I don't know if you guys liked that video. Give us a thumbs up if you did. You guys have to support us.
Support what?
Us.
I know, I'm just saying what I would be asking. Support what? You guys don't make no videos.
We're making more videos. I'm trying to daily blog, and I have to catch Marie when she's here. Even though I taught her how to blog from her phone, she don't.
My phone, I look at the news, I text, or I call. I may use the calculator.
Ooh, she's so.
And that's about it.
Computer.
If they had just a
smartphone,
regular telephone, flip phone, because you can't even get a flip phone hardly no more.
No, there's no flip phone.
You know what? If they brought an old school flip phone out, I would buy one of them. No, I don't want the ones you have to buy from like Walmart or something. Then you go have it turned on.
Get an
No,
Obama
actually
phone.
a good one. That's how am I gonna get an Obama phone? I'm already making too damn much money. Shit. How? I don't know, but
I don't know. Meet the man around the corner who got about 12 of them.
Oh, great.
Okay. Well, how did you feel about my experience at Mercy Southwest this past visit?
You know what? I used to have a lot of faith in the medical field and the hospitals and the doctors before I got with you, because I hardly never went. And when I did go, because I have a lot of family that either works in the general area of the medical field, they're not doctors or anything like that, but nurses, there's, people who, CNAs, worked in different areas, house ambulance. I mean, I have family that works in a lot of different areas in the medical field, and I used to have a lot of confidence in it, but since I've been with you, I feel like you might as well just diagnose yourself and go try to whip up some shit your own damn self, because it's there's no bedside manner with the doctors and half the nurses. You do get a few. I'm not going to say that's everybody. We have ran into a few that are excellent, and it's the fact that they generally seem like they care. Now, whether they do, they may be playing a part, but at least act like you do. There's some that walk in that just to your face, like, I'll beep, 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 beep you, and I'm going to get you, and I'm going to discharge you, and that's it, that's all. You know, as soon as they walk in, that I'm not going to get no help here.
Mm-hmm.
And that is a problem for me. Yeah. And because there is not only you, but there's other people out there, I'm sure, that have the same problems. And especially if we're required to have insurance, they should be required to act right when they treat us. True. And they don't. So it's kind of like, I'm working hard and have to get this insurance. If I don't, I get dinged. So, but when I try to go to the doctor, it's either, oh, well, you're fine, because either they don't want to do it. Prime example, probably about, I'm 45, 46, probably about 10 years ago, because I was about 34, 35. Had an incident at work, hit my head, slight concussion, never x-rayed my head. Went back to the same facility like a year later because I got migraines. My doctor asked me, what happened? Did you have a head trauma at one point? I said, yeah, had a slight concussion. Well, they didn't x-ray your head? I says, no. Well, who did you go to? Oh, I came here. Oh. Okay, so another prime example. I had hurt my shoulder, have a torn rotor cup. Still have it. 35 years old, went into the doctor, getting ibuprofen for it because, it'd get to the point where I could tell when it gets irritated because I can't lift my arm higher than this, and I literally would have to, lift it up. So I went in, asked the doctor, is there any way to fix this? I was told that I was too old. Now, this is at 35. Now, I know damn well that there's people in their 60s that have this done. There's people in their 50s that have this done. But I'm too old to get it corrected. So now I know as I get older, when I do get further up in age, especially with the job that I have now and what I'm lifting and putting on it, I know that my shoulder be done for. Mm-hmm. But at that point, I will feel like, yeah, I'm too old to get it done because most surgeries, your body doesn't bounce back like it normally would, especially as you get older. So it's just things like that irritate me, is they don't listen and they don't take into consideration what you know as a patient or a patient's family. If you go into a hospital and I'm going to use you as an example. Babe, is that okay?
Yep.
Use
me.
Okay.
Use me.
Basically because of her having had the tumor in her head and having that removed, which caused the seizures, with all the medications IV they would give her, it blew out her veins. So basically she has really no veins left.
Nope.
So when you go into the doctor to get simple blood work, we would take advantage of, like, oh, we got to go just to draw simple blood out of a vein for her to get tested is like almost nearly impossible.
Yeah, I have bruises now.
Yeah. And so when you go into a hospital and you tell medical staff, like, look, she is hard to a difficult stick. They have to get the vein finders. Sometimes they have to do ultrasounds. They have to give central lines. They'll have to do PICC lines. And this is after they poke her to death. They end up having to do this. And this is what you're telling these people prior to them seeing her. And that the whole point is they're supposed to get as much information as they can so they can treat and help their patient at that time. So if a family member was telling me that, I'm going to take that in consideration. She's been at most of these hospitals several times for this same situations. Look on your records. You'll see what you had to do with her prior here. It doesn't take a rocket scientist to figure this out. Just do a little research.
Mm-hmm.
But it's not what happens. Oh, okay. You get them coming in.
Yep.
Looking. Oh, well, can't find it here. Stab.
There's a bruise there.
Mm-hmm.
And there's a few more.
Mm-hmm. You know, and it's from her, anywhere from her. I mean, they try on her chest up here. They'll try to find in her arms, in her legs, in her feet, in her wrists, in her hands, and she'll walk out of there with tons of pokes, and then they're just trying to find an IV, just trying to find a vein so they can get an IV or draw some blood or something. And after you've already told these people this, then it's like, oh, well, we'll have to get an ultrasound. Well, why? I told you before we even got here and got to this situation. So now it's been 2 hours that she could have already been treated, because now you've sit and waited for a poke, and then, well, so-and-so, I'll go get so-and-so to do it. So now they try to bring so-and-so in to do it, and now we have to wait for them to get done. And then it's just, you get fed up. You already spend enough time. You already don't feel good. And when you have to keep going through circles with this stuff, it gets old. And like I said, I don't care if you're paying $1 million insurance, or if you're on Medicare, Medi-Cal. I don't care what spectrum you're in. Damn it, you need to be treated like a human being.
Mm-hmm.
Yes, there's people who go in there who use the system, and they go in and they will try to get drugs. They'll try to get out of the streets, to get out of the weather, we know this. That's just going to happen. But when you actually have people who have medical conditions, and you know they have medical conditions, why do you treat them as if they're less than?
Prime example, TPN setting in the background.